I'm Kim Nicodemus, and this is an assessment of the heart and neck vessels. Okay, the first thing I'm going to do is check out your carotids, and I'm going to observe, palpate, and auscultate them. So I'm just going to see if I can see the pulses. Just sit still for me. I'm not observing the pulses, but now I'm just going to palpate them, just one at a time. Great. Right side. Great. And now I'm just going to auscultate them with the bell of my stethoscope. All right. The next thing I'm going to do is check her jugular venous pressure, and I'm not really going to perform the test because I don't have anywhere to lay her down. But typically, what I would do would be to take a ruler and put it at her sternal angle, laying down, and then I would take another ruler and put it at her jugular vein pulsation, and it should form a perpendicular area, and I want it to be less than 20 centimeters. So if I was performing that test, that would be the outcome I would hope for. The next thing I'm going to do is check out your precordium, and I would be locating your apical pulse. But since I'm not going to be taking off her tank top today, I'd be looking for the apical pulse in your 4th to 5th intercostal space at the mid-clavicular line. I'd be looking for just a small pulse and noting any heave or thrill that she has. Okay, the next thing I'm going to do is auscultate her heart. I'm going to use the regular side of my stethoscope. I'm going to be auscultating the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral areas. Okay, and what I've been checking for is your heart rate, whether your rhythm is normal. I've been checking your S1 and your S2. I've been looking for extra sounds, and I've been looking for murmurs. And no murmurs noted, no extra sounds. You do have a regular rhythm, and I am hearing the S1 and S2 on every heartbeat. So I'm going to do it again. I'm going to re-auscultate with the bell of my stethoscope. Once again, the aortic, pulmonic, Erb's point, the tricuspid, and the mitral. Okay, great. Now, once again, if I could lay her down, I'd be doing some tests on you with the bell of my stethoscope. I would lay her on her left lateral side and check her apical area, and I'd be looking for any diastolic irregularities. And I can set her here, and I'm going to use the bell once again at the base of her heart and check for any murmurs. So that's the best place to check for murmurs. And no murmurs are noted. And that concludes our neck and heart.